Well, if you have a full-time job, scheduling a doctor's visit, it can be a major inconvenience. In rural parts of the state, there's often no way around it. You have to take the day off in order to travel the distance it takes to get to your doctor's office and be seen. Now, it's not a new problem in Brown County. Residents are accustomed to making the trip to Bloomington or Columbus for appointments. But as Tyler Lake reports, a clinic the school corporation is developing gives people another option.
The Brown County Community Health and Wellness Center used to be a storage facility. It now has 2 exam rooms and a small waiting area, but it fills a big need for the community. And if you're a monthly member, you can drop by as often as you please.
We call it a gym membership model. So pretty much you just pay once a month, and then that gives you access to all of the services that the clinic provides.
Full-time Brown County school employees don't have to pay anything to visit the clinic. For members of the community, it's about $65 a month. The clinic is a partnership between the school system and Wellness for Life, a company based out of Terre Haute that is embracing the subscription-based model of healthcare. That model is called direct primary care. Patients pay a flat rate for care no matter how much they use the services. Dr. Andrew Hector has been practicing direct primary care for several years. He says the biggest advantage is the amount of time doctors get to spend with their patients.
On average, probably the average physician will have 2,000 or 3,000 patients, and direct primary care will be certainly under 1,000 patients, no question about it.
It's not like going to a general practitioner where you are in, you're out, and they're just looking at the computer and not really talking to you. They take the time here to talk with you.
And still, Bruner says she saves time by coming here instead of a regular doctor's office. She's the principal of Helmsburg Elementary and says a lot of the staff in her building come to the clinic now too.
To them also, they're not taking a day off work. They're not having to write lesson plans, which is huge. They aren't spending their evenings going to the doctor and sitting in a doctor's office for who knows how long.
The number of people getting treatment at the clinic has already surpassed the district's expectations, and it's only been open for about 4 months. For Bruner, it's the clinic's wellness plan that excites her the most. She comes in and uses this machine every 2 weeks. It's called an in-body machine, and it spits out information about a patient's weight, muscle mass, and how much fat they have around their vital organs.
After I saw that paper, I was like, oh wow, okay, I need to do something here. And they were wonderful. They talked to me about all of the numbers, and they talked to me about having a challenge, and I thought, I'm up for a challenge, and I need to get healthy. And so I started the challenge.
And it's working. Bruner says she's lost 15 pounds since she started coming to the clinic after it opened. The clinic serves all the functions of a regular doctor's office, and it also provides a large selection of prescription drugs, and that's all built into the monthly fee. If there's a situation the clinic doctor can't treat, she refers the patient to a hospital or a specialist. Hammock says the goal of the clinic, first and foremost, is to provide quality care to residents in the county, but it's also saving the district money. Hammock didn't specify how much, but says it's significant.
It's so cost effective, and genuinely we're able to manage costs in our own location that would have been, exorbitant had we had to, send that off to a specialist somewhere else.
The direct care model does work better in some cases than others. It's particularly useful in rural areas where there aren't as many healthcare options. Some local Brown County businesses have signed up their full-time employees to get access to care through the clinic. Right now, the clinic is only open about 2 days a week, but as more people join, Hammock says the clinic will expand its service hours. In addition to school employees, there are about 65 residents signed up for the clinic.
So we're really trying to get to that 5-day-a-week opening, and we're getting there.
For Indiana News Desk, I'm Tyler Lake.